There it is. So, good morning, everybody. Welcome. My name is Dr. Emily Bands, and I'm going to be facilitating our webinar for today for the WIN for Supportive Housing Learning Community, the Unified Path, Maximizing Wellness with Integrated Housing and Healthcare. Just to let everybody know off the bat, the PDF of the PowerPoint is in the chat. We have the PDF, and then I also have a link to the presentation as well. So before we get started, just some housekeeping. Welcome. Today's webinar is hosted by DVHR through the Washington State Healthcare Authority. This is an interactive training, and we encourage you to ask questions and participate throughout the session. A note about artificial intelligence. Please note that the use of automated note-taking bots or similar tools during Washington FCS events or meetings requires prior approval. Unauthorized use of such tools is prohibited to ensure the privacy and confidentiality of all attendees. Also, any recording that is created through AI is not recognized as an official recording of this session, and we do reserve the right to exit trainees from the training if they are using AI to take notes without prior approval or using AI to record the session. So if you do have an AI note taker bot currently active, please deactivate it, turn it off. And please let me know if you have any questions about that. So in terms of the materials and recording, so we are no longer, or Washington HCA is no longer emailing recordings and the PowerPoint to participants. So as I said, I did upload the link to the PowerPoint as well as the actual PDF of the PowerPoint in the chat. Please note that the recording of today's session will be available on the HCA FCS channel, the Foundational Community Support's YouTube channel, approximately 2 weeks after today's session. So in terms of audio and video, we are in webinar mode. So you are unable to show your video or unmute yourself. However, I do try to make my webinars as interactive as possible. Feel free to communicate with us all in the chat. But if there is something that you really want to say that you feel would be better said verbally as opposed to in the chat, let me know, raise your hand, and I'd be happy to unmute you. When you are asking or responding to questions, please make sure that you change the "to" in the chat to everyone to make sure everybody gets that your message. And in terms of accessibility, subtitles are available, and to see subtitles, all you have to do is click on the captions button. And then again, the webinar is being recorded, and the recording will be on the YouTube channel within the next 2 weeks. So let's get to our content for today. So our main focus today is to analyze demographic trends and their impact on care planning. We're going to differentiate attitudinal versus systemic barriers. We're going to identify evidence-based models for holistic care. And then we're going to apply strategies like teach back and care coordination. And no problem, Debbie. I will put the link back in the chat. If you were on before, if you came on after I uploaded into the chat, you might not see it. But I will upload both again so folks have access. So let's start a little bit, let's start off by talking a little bit about some demographic trends. I am a big believer in context. I think context is really important. And when we're talking about aging and aging in mental health and, really focusing on the impact that aging has on all of us, I think it is really important just to talk a little bit about some trends that are happening right now. So something to really be cognizant of, for all of us to be cognizant of, is we are actually in a massive demographic shift that is sometimes called the silver tsunami. When I Googled the term silver tsunami, I actually got a lot of hits from like realtor websites because I guess the realtors are really interested in how the changing demographics are going to impact the housing market. But essentially, by 2030, all baby boomers, so everybody in the baby boomer generation will be at 65 years or older. And this isn't just a number to be mindful of, because what this is really going to mean for us is that our supportive housing programs are going to see a rapidly aging population. And many of the people you're working with, as I'm sure many of you know, right, are individuals that have, yes, you are supposed to be seeing slides. Um, can everybody see my slides? So Michaela, you might want to maybe log out and log back in, because it looks like they are they are seen by others. So I would suggest maybe logging out and logging back in. Um, okay. So I don't want to say that this trend is concerning, right? But I think it is important to just know, right, that the amount of individuals that are going to be in our supportive housing programs over the age of 65 is going to increase over the next few years. And those individuals are going to be folks that are living with a serious mental health condition and have been living with a serious mental health condition for quite some time, decades even. And we know that the individuals we work with um, already face higher rates of physical health issues, poverty, and because they are now living longer, right, and living beyond this age of 65, the need for services for this population is going to increase. So when we're thinking about why integrating um, physical health into supportive housing services is important, we're really thinking about these facts, right? So we know that individuals with serious mental health conditions do have shorter lifespans. And a lot of the times it is often due to preventable chronic medical conditions. And the reason why that typically happens is because it is almost a vicious cycle for folks at times. If I were to give you an example, if you have somebody who maybe is experiencing a health condition like high blood pressure or high cholesterol or diabetes, but at the same time, they're maybe struggling with symptoms of depression or maybe symptoms of mania or symptoms of their schizophrenia, it's going to impact their ability to be able to adequately navigate those physical health conditions, right? So they're experiencing symptoms, they're not able to manage a physical health condition, and now it's going to impact their ability maybe to adhere to any regimens that their medical providers are advising them to adhere to. It could potentially mean that they are visiting the emergency room more often, and ultimately it leads to this tragic, really tragic loss of life of these individuals, right? So our job, and what I'm hoping to do with the information that I present to you, is to really give you some tools to hopefully, fingers crossed, help you kind of break this cycle. Um, so I want to shift into some attitudinal and systemic barriers. So when we're again thinking about these barriers, we know that people with serious mental health conditions do die about 25 years earlier than those who do not have serious mental health conditions. When we're thinking about how individuals are passing, 30 to 40% is due to individuals dying by suicide, and the remaining 60% is due to quote unquote natural causes. Um, and when we think about what these natural causes are, this is what we're talking about. And I want you to skim this list of what I have here. And I want to know, I want to hear from you all in the chat. How many of you are working with individuals that have these types of physical health conditions that they're living with? And what are those physical health conditions? And I know I can speak for me. When I was working in supportive housing, um, yes, I had so many individuals I was working with who had diabetes, um, heart conditions, high cholesterol, blood pressure, history of heart attacks. Yeah, I'm seeing a lot of diabetes. I remember way back, very, very long time ago, when I was interning, um, one of the first days I was interning at my site, we had to go out and see somebody immediately because we had received a fax from their medical doctor that they needed to immediately go to the hospital because their blood sugar was like 800. So we had to like call 911 and we had to go out there, we had to meet them and we had to, encourage them to go to the hospital. It was like, it was very concerning. Um, and then, yeah, absolutely, Kimberly, right? And now we're coupling these physical health issues with anxiety, depression. And yes, absolutely great point, Joshua, right? So many of these are also disproportionately seen in communities of color too. And we're going to talk a little bit about the social determinants of health in a couple of slides. Um, and that also plays into these kind of systemic issues. So yeah, I'm seeing diabetes, obesity, chronic pulmonary disease, cardiovascular disease, osteoporosis. When we think about some of these, right, cardiovascular disease is the leading cause of death in this population, and people with serious mental health conditions have much higher rates of heart disease due to factors like medication side effects, smoking, poor diet, and lack of access to consistent medical care. A lot of you mentioned diabetes. Many psychiatric medications, including and especially antipsychotics, can increase the risk of weight gain and insulin resistance, as well as metabolic changes, which all can contribute to somebody developing diabetes. We also see respiratory diseases. How many of you out there have clients who still smoke? We do know that smoking is significantly more common among individuals with serious mental health conditions compared to the general population. We also see individuals with different infectious diseases. I also, for me personally, I saw this with a lot of individuals who maybe spent time unhoused. So they would have chronic infections like hepatitis, HIV, or other types of infectious conditions that end up going untreated because they're unhoused, right? So they don't have access to that health care. Or individuals with different types of infectious diseases are stigmatized, right? There's a stigma that hangs over them for having that. And that can impact their desire to want to seek treatment. When we're thinking about we're talking about circulatory diseases, obesity, hyperlipidemia, osteoporosis. All of these conditions also tend to develop at higher rates and do often go untreated. And I think the main thing I really want to drive home with this slide is that how many of you know somebody with high blood pressure or diabetes or osteoporosis, chronic pulmonary disease? How many of, excuse me, how many of you know somebody in your personal life that has or maybe had one of these medical conditions? And I'll raise my hand too, because I have as well. And you can just give me a yes or a no in the chat. Yeah. And how many of you maybe know somebody who had one of these conditions, but maybe they passed away at an older age, maybe in their 80s or even their 90s? And you can just give me a yes or no. And I can share something personal. My grandmother died in her 80s. She smoked from the age of probably 13, not 13, maybe like 16, 17, 18, into her 80s. And she ended up passing away of a heart attack, and kind of some conditions that came from that. But she lived a very, very long life, right? So my then question comes about because those of you out there are agreeing that yes, you know individuals who have these types of health conditions but continue to live on into their 80s, right? Yet we know that individuals with serious mental health conditions, these conditions are causing that quote unquote early death due to quote unquote natural causes. And that's alarming to me, right? And I think it really does come down to lack of access or lack of consistent access to good medical care, or good medical follow up. I know for me, again, with my grandmother, we were taking her to the doctor. She was going to the doctor. She was going to her follow up. She had good medical care. And we know that access is an issue for a lot of the individuals that we're working with. But even if access continues to be an issue, because that's a systems issue that we can't necessarily change, there are still things that we can do to support folks to ensure that they can continue to live long, healthy, somewhat healthy, good, happy lives. I do want to delve a little bit deeper into metabolic syndrome, because we do know that a lot of the individuals that we work with in supportive housing do have metabolic syndrome. Does anybody here know, is everybody here familiar with metabolic syndrome? Okay, I'm getting some yeses. I'll talk a little bit about it. Um, but metabolic syndrome is a cluster of health risk factors that dramatically increase the likelihood of developing type 2 diabetes and heart disease. So metabolic syndrome is especially important to consider in the context of individuals with serious mental health conditions because individuals with serious mental health conditions often experience metabolic syndrome at much higher rates than the general population. So the first risk factor is abdominal obesity. And obesity, central obesity, abdominal obesity is one of the strongest predictors for metabolic risk. Elevated triglycerides, which is higher levels of fat in the blood, and this increases the risk of cardiovascular disease. Elevated low density or LDL cholesterol, which is the bad cholesterol. And when LDL levels are high, plaque can build up in the arteries, which again leads to heart disease or stroke. High blood pressure or hypertension is another factor, and many individuals with serious mental health conditions struggle with long-term hypertension due to either lifestyle factors, stress, or medication side effects. And then of elevated fasting glucose, and this indicates insulin resistance and is a major warning sign for type 2 diabetes. And together, all of these factors form metabolic syndrome. And something I really want to highlight is that 22% of the general population has metabolic syndrome, whereas 43% of people with metabolic syndrome are individuals who have a diagnosis of a serious mental health condition. So it really is important for the individuals we're working with to monitor their physical health, especially their weight, their blood pressure, cholesterol, glucose levels. And early detection and regular screening is something that can significantly, reduce some of these long-term health effects or health risks, I should say. But there's a lot we're going up against. There's a lot we as practitioners have to go up against, and there's a lot that the individuals we're working with have to go up against, right? Because there are a lot of factors that contribute to poor health. It's not, it's not as simple as eat healthy versus not eat healthy. A lot of the individuals we're working with have medication side effects. And let me know in the chat if this sounds similar to anybody that you're working with, where people are experiencing weight gain, metabolic changes, or even dental problems due to medication side effects. A lot of psychiatric medications do cause dry mouth, which increases the risk of tooth decay and gum disease. And for a lot of individuals with serious mental health conditions, dental issues often go untreated, which can lead to pain and infection and worsening physical health overall. Um, when we're thinking about unhealthy behaviors, those are things that can be influenced by somebody's mental health symptoms. It could be due to stress, or it could be due to lack of support or limited resources, right? So, lack of access to preventative screenings, somebody using substances, somebody having a poor diet or smoking, and then also low levels of physical activity. And these types of behaviors can play a major role in folks developing a chronic illness. Psychiatric symptoms themselves, particularly those negative symptoms that people experience, which are a lot, most of the time related to and within depression, can really make it difficult for individuals to feel motivated, to be able to follow through with health-related activities such as exercising regularly, attending appointments, cooking healthy meals. And then we also need to consider this inadequate access to healthcare. Many people, as I'm sure you know, with serious mental health conditions do face barriers such as lack of transportation, limited insurance coverage, long wait times, or difficulty navigating the healthcare system. And as a result, a lot of their physical health issues end up going under, they're either unaddressed or they're not addressed at all. Something else to, of course, consider is discrimination within healthcare settings. Sometimes providers focus primarily on an individual's mental health condition and, don't always consider the physical health complaints or minimize the physical health complaints. How many of you have maybe gone to the doctor yourself or gone to the doctor with somebody and someone has complained of pain or a stomach ache or maybe heart palpitations? And the doctor has said, well, are you sure it's not your anxiety? Or are you sure it's not your symptoms of depression? Has that ever happened to anybody? Yeah. Shelby, it sounds like you have a really great doctor. I'm happy to hear that. Yeah, it does. It definitely happens. Maybe not all the time, but it definitely does. And that leaves things untreated. And I've heard of many stories of this, especially again happening to women and happening to people of color, where they are reporting experiencing physical health symptoms, and it's being attributed to their mental health. And it turns out, after that person having to advocate for themselves, that now they have a serious health condition that could have been treated or is now going to take a longer course of treatment because it took months or years for it to be found because it was being ignored by their healthcare provider. So these are some of the factors that contribute to poor health. And I want to dive a little bit deeper into this and talk a little bit about the social determinants of health. Is everybody here familiar with the social determinants of health? Okay. Getting some yeses. Um, but I want to make sure we are all on the same page. So I'm actually going to pull up a video for all of you on the social determinants of health. And this will give us a really good overview so that we're all on the same page.
I should really go to the doctor, but the closest office is an hour away. I can't take that much time off work.
Since I got laid off last month, I felt so stressed. I need to provide for my kids, but no one is hiring. I don't know what to do.
I used to know every single person that lived on my block. Now I don't even recognize the place. There's just no sense of community anymore.
When we talk about how to maintain our mental and physical health, we often focus on things like eating healthy and going to the doctor. But our health isn't just affected by the choices we make, it's impacted by our environment. The conditions in which people are born, grow, work, play, learn, and worship are called social determinants of health. Social determinants of health can be visualized as a river with two categories of determinants: upstream factors and downstream factors. Upstream factors occur at the systemic level. Examples include institutional discrimination and accessibility of education, employment, housing, healthy foods, and quality health care. Downstream factors are specific to individuals. Examples include employment status, level of education, and aspects of identity such as gender, race, and disability status. Just as building a dam upstream impacts the flow of a river downstream, upstream social determinants directly affect downstream ones. Consider race. In and of itself, race does not impact health. Rather, systemic racism leads to consequences like less access to employment and education, which in turn negatively impact health. To begin to recognize the relationship between social factors and health, consider these statistics. Suicide rates are highest in the Western American states and in Appalachian regions. Non-Hispanic Black individuals have the shortest life expectancy of any racial group, and the mortality rate of Black infants is more than double that of white infants. And as compared to people with an annual family income of $100,000 or higher, people with a family income of $35,000 or lower are 5.4 times more likely to experience serious psychological distress, but 10.6 times more likely to go without needed care due to cost. Tackling the social determinants of health, especially the upstream factors, can seem like a huge task, but we can all make a difference by advocating for change in our own communities. A good place to start is with the U.S. Healthy People website. This site has stated goals related to social determinants, which are aimed at improving the following. 1. Access to jobs, food, and housing. 2. Access to education. 3. Community connectedness and inclusion. 4. Access to health care and health literacy. And 5. Neighborhood safety and housing quality. Throughout this process, remember that systemic issues impact individuals differently, that people are the experts of their own lives, and that social structures won't change overnight. But with empathy and sustained effort, we can better the health of everyone.
So I really like this video because it provides a really good, that's what I'm looking for, a really good.
You should get life insurance because you never know. My dad has never been in better shape. Okay. Lost weight, exercising.
Thank you. It provides a really good overview of the social determinants of health. And I'm going to put the link to the video in the chat because everything I'm going to go over, and I hope you see all my tabs up here because those are all things we're going to go over. Everything is linked in the PowerPoint. I did put the PowerPoint again in the chat, but this is the link to the social determinants of health video. So when we're thinking about what the social determinants of health are, I'm going to progress to this slide. And the biggest takeaway when we're thinking about the social determinants of health is how different environmental conditions, and remember, there are certain aspects of our environmental conditions that we cannot control, right? We can't control where we're born. We can't always control where we're living and where we're learning. We can't always control where we're working, where we're playing, and we're worshiping, right? Some people do have choices in these matters, but some people don't. But we're looking at how these different environmental conditions are now impacting outcomes related to health, quality of life, and well being. And when, if we look at this a little bit further, right, we're thinking about how these other factors like violence, racism, and discrimination also play into this. Okay. So when we're thinking about the social determinants of health, right, we know that they have a major impact on those areas of someone's life, right? Health, well being, and quality of life. So if we were to get more specific, we're thinking about safe housing, we're thinking about access and accessibility to transportation, we're thinking about the types of neighborhoods someone is able to live in and how neighborhoods are potentially being impacted by things like gentrification. We're thinking about our health, right? Again, access to healthcare, access to the pharmacy, doctor's appointments, nutritious foods, whether or not somebody is living in a food desert, whether or not someone's living in a medical desert, whether or not someone has access to physical activity, right? And then we're thinking about social relationships and how those social relationships impact and influence our mental health, our physical health, and contribute to healthy habits. And all of those things are living in the context of these systemic issues like racism, violence, and discrimination. So when we're thinking about social determinants of health, right, they contribute to wide health disparities and inequities across communities. So for example, if somebody is living in a food desert and they don't have access to grocery stores, that means they're going to be less likely to access healthy food and good food. And that's going to then raise their risk of certain health conditions like heart disease and diabetes and obesity, which is then going to lower their life expectancy in relation to individuals that are not living in a food desert and do have access to healthy foods. So again, it's not as simple as just eating healthy, right? Promoting healthy choices is not going to fix or break down these systemic barriers and these different health disparities. It's really important for public health organizations and their partners to really take action to improve the conditions in people's environments, right? This is a systemic issue. And it's an issue that we as community mental health providers working in supportive housing programs do have to go up against. The other aspect of this, and I wanted to hone in specifically on healthcare and reduced access to healthcare. I did a social determinants of health two-part series a couple of years ago for this Win for Supportive Housing Learning Community. And I was shocked by all of you telling me how hard it was to access healthcare for the individuals that you're working with, right? That a lot of you are working with folks who are in medical deserts. So I wanted to kind of bring this back into the conversation because again, I think context is really important because it is important to consider how the barriers that individuals face to receiving healthcare can lead directly to these poor outcomes for folks. So when we're thinking about the three main barriers To healthcare, we're thinking about lack of health insurance or only partial coverage. We're thinking about a shortage of providers. And again, that's where those medical deserts or healthcare deserts come into play, and a lack of transportation to appointments. So, how many of you out there have individuals who receive Medicare? And you can just give me a yes or no in the chat. Do you have anybody that you're working with Medicare? Yeah. Now, Medicare, as many of you know, doesn't cover the full cost. So, do you have any individuals that you're working with that are foregoing healthcare because Medicare does not pay the full amount for things? And maybe they can't afford that additional coverage. Yeah. Yeah. And then maybe for those of you who um, maybe don't have individuals who have Medicare, but how many of you have clients that maybe aren't going to the dentist or the eye doctor because their health insurance doesn't cover those types of services? Yeah. Yeah. And as somebody who wears glasses, uh, not going to the eye doctor or not being able to access the eye doctor would absolutely be debilitating for me. Because if I take my glasses off, there's not a lot that I'm going to be able to see, to be 100% honest with you. Um, and yeah, it 100%, Lydia, it deters people because navigating the system, if the insurance is not covering the service, is too complicated. Um, it's too costly, right? And this is where these poor outcomes come into play, right? People are going to be less likely to seek care. They're not going to receive that preventative care, right? So when I go to the eye doctor and they want to do that little, I don't know if any of you have glasses out there or contacts, but they want to do that test where they can see in the back of my eyeball to make sure I don't have glaucoma or make sure I don't have cataracts or, make sure I don't have anything weird going on back in my brain. You forego that, that's going to potentially lead to um, a more serious physical health issue that I'm not going to be able to catch because I'm not getting that preventative care because I'm not going to the eye doctor every year. And people are more likely to be hospitalized because, again, they're then made to wait or forced to wait until essentially the last second to receive care. Excuse me, because now they're getting care when they need it the most, which is, when it's time to go to the emergency room and they're being hospitalized. How many of you are working in an area where there's either a shortage of healthcare providers or healthcare providers that are in network are hours away? Yeah. Thank you, Serena. You're in a very rural area. Anybody else? Closest specialist is 2 hours away. Wow. And yeah, Maurice, that's a great point, right? How do we even get people access to insurance, right? They can't go to the doctor without insurance. And then once they have insurance, maybe the closest specialist is 2 hours away. These are huge barriers. And I'm not going to talk about advocacy in this specific webinar, but I will say this is where advocacy can really come into play. Because we do really need to advocate to our state governments, to our county governments, to stakeholders, to try to, resolve some of these systems barriers. And then, yeah, Kelly, you also bring in a really great point. If you are going to a specialist 2 hours away, you don't know that the care is actually going to be good that the person is receiving. So we are up against, you all are up against a lot of barriers working with individuals in this population. But there are some things that I'm going to share with you. I don't want to end like, oh, sorry, this is it. We have systems barriers. No, there are things that you can do to try to better support some of the folks that you're working with. And it's not going to solve these systems problems, but I want you to walk away feeling like you have some tools and feeling empowered. And I do want to acknowledge what Kat said. We are near hospitals who patch people enough to keep them alive, no more. We've had men with concussions or fresh from surgery sent back to us with no real care. Oh, and if they aren't immediately dying, they'll just be tossed out onto the street. That is scary, Kat. That is incredibly scary. I'm so sorry that that is something you are experiencing and that the people you're working with are experiencing. So let's talk a little bit about strategies. And we're going to talk a little bit about integrated care principles. We're going to talk a little bit about using a multi-dimensional model of wellness. And then we're going to talk a little bit about different skills training and education that you can do with the individuals that you're working with. So when we're thinking about integrating care, there are benefits to integrating care. Okay. So one, right, we're providing individuals more holistic care because we're addressing both the physical and mental health needs of the person, which is going to improve their overall well-being and housing stability. Okay. We're also increasing resident or individual engagement, right? Because this integrated care is going to foster trust, it's going to foster deeper communication, and it's going to encourage folks to be more engaged in their own health and their housing simultaneously. And then there's this aspect of early intervention. You all can be the key. I know you all have a lot on your plate already, but you all really can be the key to help folks identify some of these health challenges that they're experiencing early, which could prevent crises and support individuals' long-term success. So when we're thinking about integrated care, we're thinking about applying these principles into your work on a day-to-day basis. Okay. And I'm going to explain what each of these principles are in the context of supportive housing and talk a little bit about how you can actually implement some of these, right? So when we're thinking about interpersonal communication, we're talking about the ability to establish rapport quickly and to communicate effectively with the people that you're working with, their family members, as well as their medical providers. And this includes active listening, which I'm sure all of you are doing, conveying information in a jargon-free, non-judgmental manner. And we're going to talk a little bit about teach back for understanding. And that's a really great way to communicate health-related information to folks. Using terminology that's common to the setting, and really adapting to the preferred communication of the person that you're working with. So making sure that you are adapting materials to them, right? So if the person is more of a visual learner, trying to find materials that are more visual, maybe blowing up the print so it's bigger and easier for them to read, making sure that you're providing materials at a literacy level that is in alignment with what the individual you're working with their literacy level. When we're talking about collaboration and teamwork, we're talking about trying to expand that interprofessional team to not just include the people that you're working with at your organization, but also including the person's primary care provider and maybe any family members that are involved. So, really, working to effectively communicate and express professional opinions, and resolving maybe any differences in opinions, providing and seeking consultation, and really fostering that shared decision making for the individual, to ensure that the individual is really making their own choices, and supporting the choices that the person's making. Screening and assessment, right? So being able to conduct brief and evidence-based screenings to conduct or arrange for more detailed assessments when indicated. So we're going to talk about, and I'm going to provide you a resource for assessments, where the individuals that you're working with can actually take these assessments and use these screening tools on themselves, and you can support them in doing that. Care planning and care coordination is creating and implementing integrated care plans. So making sure that on the ISP or maybe whatever care plan the medical provider has, making sure that medical health and mental health are integrated within those plans for individuals who do have medical conditions as well. So when we're thinking about intervention, we're really focusing on prevention, recovery-related services, as well as potentially longer-term treatment for folks, depending on what their medical condition is. So it could be doing a health fair at your organization, again, providing some more of that health education to folks one-on-one, maybe having more health-related groups, if you all are conducting groups at your agencies, making sure that you are addressing substance use, co-occurring substance use, and mental health conditions, and supporting individuals to access any medications that they need. In terms of cultural competence and adaptation, or adaption, that's ensuring that the services you're providing are relevant to the culture of the consumer and their family. So again, being mindful of those disparities in healthcare that could be related to the person's race or ethnicity or culture, making sure that services are adapted to their language preferences as well as cultural norms when it's feasible. And promoting diversity among providers when it is something that is feasible and accessible to the person. When we're thinking about a systems-oriented practice, we're thinking about the ability to function effectively within the organizational and financial structures of the local system of healthcare. So that's, which I know a lot of you do this already, understanding and educating, helping consumers to understand and educating them on their healthcare benefits, navigating and supporting individuals to attain different benefits, and adjusting any services so, to ensure that they're in alignment with any new healthcare research. In terms of practice-based learning and quality improvement, you want to make sure that you as an organization are assessing and trying to improve the types of services you're delivering, as well as trying to improve that relationship between you and the other professional and like the interprofessional team when you're working with medical providers. So that could look like identifying and implementing evidence-based practices, assessing treatment fidelity if you're using a specific model, measuring consumer satisfaction, and measuring and collecting data on healthcare outcomes at your organizations, and recognizing and rapidly addressing any errors in care, and really just making sure that you're collaborating. And then finally, you can implement informatics. And that's using technology to support and improve integrated healthcare, right? So making sure that if you have an electronic health record, it's being used efficiently and effectively, using computer or web-based screening and assessment intervention tools, which we're going to talk about, using telehealth if it's something that is allowable. And then, as always, making sure that we are safeguarding the privacy and confidentiality of folks. So if you can, there are a lot of different ways to integrate these care competencies at your organizations. And even just integrating one or some of these competencies is something that can be helpful to folks. And again, the main goal is to ensure that we are working collaboratively with other professionals, because unless you are a nurse out there, you all aren't medical professionals, and that's okay. You all are the experts related to behavioral health. But we also want to make sure that when we can, that we are coordinating care with those behavioral health, professionals. Excuse me for 1 second. I have to let a cat out of the room. Just going to pause the recording for a second. Go. Thanks, go. You hear meowing, just know it is a very unhappy cat that won't leave the room. So let's get into the 8 dimensions of wellness. So is everybody here familiar with the 8 dimensions of wellness? I am on mute. I apologize. So thank you. There are many dimensions of wellness out there, models of wellness, I should say. Some have more than 8, some have less than 8. We in my department love this 8 dimensions of wellness here. It's something that SAMHSA has also endorsed. And when we're looking at these 8 dimensions of wellness, it was developed to help individuals understand well-being in a more holistic, comprehensive way. And I really want to highlight the visual aspect of this slide, that we have these different circles that are overlapping, and each circle represents a different area of wellness, and they're overlapping for a very specific purpose. And that's to help people visually understand that our wellness, our areas of wellness are interconnected, and they do impact one another. So if you have somebody who you're working with that is actively experiencing symptoms of depression, maybe they are isolating, maybe they are spending a lot of time in bed, maybe they are sleeping a lot, not taking care of their hygiene, that is 100% going to impact other areas of wellness for that person. So their environment might be impacted, right? They're not doing the dishes, they're not taking out the garbage, they're not cleaning and tidying their apartment. Their physical wellness might be impacted, right? Because maybe they're not getting a lot of sleep, or maybe they're getting too much sleep. Maybe they're not getting a lot of physical activity. Maybe their occupational wellness is being impacted because they're missing work. Their social wellness is being impacted because they're not spending time with friends and family in the way that they used to. And their financial wellness is being impacted because they're missing out on work, right? So it is really important to understand that wellness, our wellness is interconnected in these different areas, and nobody is perfect, right? Nobody is going to be at 100% in every single one of these areas. But we want to be more cognizant as individuals and as practitioners of how one area might be impacting another area. Because we can go into somebody's apartment and we could focus on their environment and the fact that there's dishes all over the place, or there's dirty laundry, or they haven't taken their garbage out. But is the person in a state of mind where they can address those things? Or is it that we need to support them in addressing their emotional wellness first before we can get to that environmental wellness? So that's the 8 dimensions of wellness kind of in a nutshell. There's tons of information out there. You can Google SAMHSA 8 dimensions of wellness and you'll get a lot of great information on that. But I really just want the biggest takeaway with this slide to be that our wellness is interconnected. And it is important for us as practitioners just to be mindful of that when we're working with folks, because we have to be cognizant of how one area of wellness might be impacting another area of wellness. So let's get into some more practical strategies that you all can use when you're working with people, right? So the first thing that you can do when you're working with folks is to use skills teaching to support them in learning and implementing skills in their life that they might need related to their physical health and wellness. So it could be skills related to cooking. It could be skills related to managing medication. We teach the tell, show, do method. If you've been through the golden thread of documentation training, you've probably seen and are familiar with the tell, show, do method. But the tell, show, do method basically focuses on establishing a rationale for learning the skill with the person. And this is going to support them in being able to find that buy-in and that motivation to learn the skill. You're going to discuss and develop the steps of the skill with the person. And then you're going to model the skill, and then you're going to have them do the skill. So you're going to have them try the skill out. You're going to provide some feedback. If you do give some corrective feedback, you might ask the person to practice again and provide additional feedback, always making sure that we're having the person practice the skill for homework. I always recommend that people write down and collaborate with the person to develop the steps of the skill. I've had many a situation where I've gone out, I've met with somebody, we've worked on a skill, we've wrote down steps, and I've, for whatever reason, taken those steps with me back to the office, or maybe we didn't write them down at all. And I've gone back the next week to see the person and I've asked them, hey, did you practice this skill? And they say, no, I forgot the steps of the skill. So it's really important to make sure that they have a copy of the steps of the skill and that the office has a copy of the steps of the skill. And that's going to make sure that the person is performing the skill the same way every single time consistently, because that's going to help the person to learn. If you think about a skill like washing your hands, when you wash your hands, how many of you go into the bathroom and talk yourself through how to wash your hands and go through the steps of washing your hands through your head, in your head? Do any of you do that out there? And you can just give me a yes or a no. I'm assuming I'm going to get a lot of no's. Right. No, not really, right? Because we all know how to wash our hands. It's something that is now concrete in our brain. We don't need to go into the bathroom and say, I'm going to take my left hand and I'm going to turn it and I'm going to turn the faucet towards me and I'm going to, put my hand under the soap pump and I'm going to press down 3 times. We don't have to do that because we know how to perform the skill. When you're using the stove, when you're using the microwave, you don't need to run through those steps in your head. But when we're working with folks who are maybe don't know how to cook on a stove or don't know how to use a microwave or don't know how to cook certain recipes, they're going to need those steps. And we want to make sure that they have them so that they're getting to the point where they're overlearning this skill and they don't need to think about it anymore. Something else I want to talk about is teach back for understanding, and low health literacy is where we kind of need to start. So how many of you are familiar with this information, that overall Americans have a low level of health literacy and numeracy, and that the average health literacy of someone is a 7th to 8th grade reading level, and the average reading level for someone with Medicaid is 5th grade. Is everybody familiar with that information out there? And if not, that's okay. That's why we're talking about it. But typically, people are reading at a 7th to 8th grade reading level. And individuals that we're working at specifically are reading at a 5th grade reading level. And studies have shown that 40 to 80% of medical information that people are told during office visits is forgotten immediately, and nearly half of the information attained is incorrect. So we're working up against a couple of barriers here, okay? So when health information is being explained to us, it's being explained at a very high level, right? Because doctors are explaining it to us. You can give me a yes or no in the chat. How many of you have gone to the doctor and had a doctor explain something to you and have had no idea or very little idea what the doctor is actually trying to say to you, or what the doctor actually wants you to do after the visit? Has that ever happened to anybody? And then how many of you have maybe gone to the doctor and thought you had a really good idea of what the doctor was asking you to do, and then you got out and you went in the car and maybe you called a friend or your spouse or a family member to tell them what happened at the doctor's appointment, and and you had no idea, you got on the phone and were like, oh, I completely forgot what the doctor actually told me to do. Has that ever happened to anybody? Yeah, pretty often. And it's normal, right? It's natural. But if these things are happening to us, then these things are absolutely happening to the individuals that we're working with. So it's really important to be mindful of this, because this is going to impact the people that we're working with, their ability to be able to retain the information that doctors are giving them, as well as understand the information that doctors are giving them. And that's where we can use something called teach back for understanding. So teach back for understanding is a research-based health literacy intervention that is shown to improve outcomes, in the sense that it does increase understanding of the information, which then ends up increasing adherence to the information. And it has also shown to lead to a decrease in callbacks as well as canceled appointments. Now, something to consider with Teach Back for Understanding is that it is a way to make sure that you, as a support worker, are explaining information clearly to the person. It's not a test or a quiz for consumers. So you want to make sure that you're asking the consumer to explain in their own words what they need to know or do in a caring way. And it's also a way to check for understanding and, if needed, re-explain and check again. So these are the steps to teach back for understanding. So after health information is shared, you're going to ask the person to explain in their own words with open-ended questions what exactly it is they heard. And you really want to focus on what exactly it is they need to know or do. Sometimes, information we're given goes a little broad. We really want to distill that down into the information that the person really needs to know or really needs to do. And you're going to, again, do that by asking questions and really ask them to explain it in their own words, right? Now, if the information is incorrect or incomplete, that's where we can re-explain it patiently. And we want to check again with non-shaming, open-ended questions. Okay, so we want to make sure that we are being really mindful of whatchamacallit. We want to make sure that we're being really mindful of the person's kind of frustration, right? I know for me, when I'm being told by a doctor something and the doctor is explaining something to me and I am not understanding, I get really frustrated at myself, right? And that's why we want to be patient with the person that we're working with, because we want to be mindful that it can, it's hard when you feel like you don't know something, okay? And again, we're being curious. We're just trying to understand whether or not the person understands what exactly is being told to them. So we want to make sure we're using plain language, that we're being mindful of our own body language, and we're using a caring tone. And again, that we're using reading friendly materials. So big font if needed. If you know the person's education level or reading level, making sure that you're finding materials that are specific to that level. And again, making sure that we're focusing on the fact that individuals are, this is about us being able to explain the information to them. We're not trying to test consumers. And the last group of things I want to give to you is support you in being able to screen and identify people's health needs. So being able to provide or support people in attaining basic health screenings can be really helpful to folks, especially if they are not in a position where they're able to go to the doctor regularly or accessing the doctor regularly. As a frontline staff, you want to try to be mindful of signs of physical or mental health issues. If you have a nurse on staff or an LPN on staff, this is something that would be a great role for them, especially if they're doing any types of nursing assessments already. You also want to be in a place, again, where you're being collaborative and we're supporting people to get those referrals to any healthcare specialists that they need. Something else that you can do is resource mapping, and we're going to talk a little bit about basic resource mapping that you can do at like a county level. And then something else that you all can do in this realm is just to create wellness plans with people. It could be separate than their ISP. It could be something that they keep on their something that they're working on individually, and maybe just something we're helping them develop. But it's really, again, to support the person in shifting their focus more onto their physical health, or trying to have a more balanced focus of their physical health. So something that you all can use with people is the Medline Plus Health Check tool. So I'm going to stop sharing this for a second, and I'm going to go back to my Chrome. And bear with me because I have this on a separate screen. So this is the website, and this is clickable in the PDF. So when you look at the PDF and open it, all you have to do is click here where it says Medline Plus Health Check Tool, and it links directly to it. But this is the tool. And you can assess your health with these interactive tools. There include calculators, quizzes, and questionnaires. And these are things that you can do on your own if you wanted to assess your own health, but also things that the people that you're working with can use. And if you have a computer, you can support them to use some of these. So the first one I have here is the virtual allergist. And this can give information on allergy and asthma symptoms, and kind of give you an idea of what you're experiencing. So once you fill it out, you can have this conversation with the allergist. So let's say you're having some lung and chest issues. You select the different symptoms that you're experiencing, and it gives you a list of other issues that you might have. And then gives you an overview of what that actually looks like, and gives you some good information on that. So that's the allergy one. This is the colorectal cancer risk assessment tool, an online calculator. So you can calculate your risk here by filling out all of these questions. So there's demographic questions, there's diet and physical activity questions, there's medical history questions, and then family history. And then once you fill out all of these, it's going to calculate your risk. And that will give individuals information that's needed in order to help them to, seek care if needed, right? If you have a higher risk of this, then maybe this is something I need to continue to follow up on. The next tool is the type 2 diabetes risk test. And again, all you do is click. I'll say I'm taking it for myself. You put in the years, you answer all the questions, go through all of this, and then it'll tell you what your risk factor is for diabetes. Or type 2 diabetes. So this is something you can do with any of your clients who maybe don't have type 2 diabetes, but maybe are concerned. Maybe they have a family history. This one is a hearing test assessment. So you answer these questions, yes or no. And then if you've answered yes to 3 or more of these questions, you might want to see an ear, nose, and throat specialist or see an audiologist for a hearing evaluation. This is the IBS test. It's the on the slide, it's the take the IBS test. So again, these are very simple yes or no questions. Do you have recurrent abdominal pain, frequently constipated? Have you talked to your doctor about this? And what you can do is fill this out, and this is something that you can bring, or the individual that you're working with can bring to the doctor with them. We also have the menopause map, and this is for your female clients. It has a lot of different information on what menopause is. You can start your journey here and answer questions, and that's going to help folks to have a custom plan to help you navigate steps related to menopause. And there's also some good resources here. There's some symptom trackers that you can use. And then the last one that I wanted to highlight is how strong is your nicotine addiction? So this could be a good information for individuals who are smokers. Maybe you have somebody who is kind of thinking about smoking. But there's many tools on here. I just kind of highlighted a few. But there's tools. These tools are also updated pretty often. It's just a lot of good information for the people that you're working with so that they can screen for some of these things. The next thing I want, and before I move on, does anybody have any questions about this? Is anybody familiar with this website? Okay, awesome. I'm happy that this is, if it's a refresher, I'm happy it's a refresher, but I'm happy this is some new information for all of you. So the next thing that I wanted to talk a little bit about is resource mapping. And resource mapping is, I would say, going to be difficult in Washington State because you have a really big state. So that's why I put it down to county to maybe break things down a little bit. So maybe if you have a county mental health board, or maybe you're in a county and you know other providers in the county, this is a way for you guys to kind of work together and share resources. And these are the types of resources you want to consider for any resource mapping that you do. So in terms of physical health resources, getting together a list of primary care clinics, emergency services, specialist care, chronic disease management programs, public health services, pharmacies, wellness and preventative services, maybe even having like a rating system. Where you're doing like 5 stars for someone who's really good, no stars for someone who isn't a great provider. So at least people have that information off the bat. And then mental health resources. So where folks can get individual therapy, psychiatrists, crisis intervention services, support groups, substance abuse services, and community mental health centers. Now, your organization can very much develop this list on your own, and you could totally do that. But I am going to encourage you to consider this as a way to kind of work together, and see if people within the counties can get together and work to come up with these resources, because this is going to be a lot of resources and it's going to be a lot for one person to have to manage and navigate. But your individual organization could definitely come up with this list on its own. When we're thinking about daily care integration, really focusing on just ensuring that your programs are integrating these types of services. So making sure there is that coordination between health and housing services, using peer support when you can, obviously incorporating that mental health support, which I know all of your organizations do, incorporating that with that physical health support and encouraging people to get routine wellness checks. And the last thing I wanted to share with you is the AHRQ Question Builder app. And there's 2 resources here. One is how to prepare for a doctor's appointment, and one is talking with your doctor worksheet. And the first thing I'm going to share, let me go here. Okay. The first thing I'm going to share is these 2 worksheets. So you can use these worksheets to organize your questions, family and medical history, and information when talking with your doctor, and you can download, print, and copy the worksheets. So these are worksheets that you can actually print and fill out with the person that you're working with. And these are things that you can keep on hand and handy dandy so that people have them when they go to the doctor every time they go to the doctor. So recording your family health history, questions to consider when choosing a new doctor, life changes to discuss with your doctor, prioritizing concerns to share with your doctor, and then tracking your medications. And then this one is how to prepare for a doctor's appointment. So again, you can use the talking with your doctor worksheet as well. But this just kind of talks about different things that you can do to prepare for a doctor's appointment. And it might be worth it to go over some of this information with some of the individuals that you're working with. But this is the Question Builder app through AHRQ. And what this does is it helps patients and caregivers prepare for medical appointments and maximize visit time. And what I'm actually going to do is I'm going to share this really short video because he explains what this app is much better than I could ever explain it.
Research shows that asking questions and sharing information with your healthcare providers can help improve your care. Healthcare is a team effort. Being prepared means you won't feel rushed or forget to ask a question that is important to you. That's why I want to tell you about an exciting new mobile app we have developed called the ARC Question Builder. We built this app to help you prepare and get the most out of your next medical appointment by harnessing the power of the digital age. ARC's Question Builder app maximizes the time you spend with your clinician by allowing you to organize and create questions in a fast, intuitive, and easy to use interface. Whether you are a patient, family member, or caregiver, this mobile app truly gives you the tools you need to get prepared for your next medical appointment. ARC's Question Builder app is free and can be downloaded on your smartphone, laptop, or tablet. To download the app, go to the Apple App Store or Google Play Store and search for ARC Question Builder. This app is one of the most innovative ways ARC is supporting the HHS priority of increasing the value of healthcare. By empowering patients with data and the latest technology, we are enabling the delivery of high quality, safe, and high value care to every American.
So is anybody out there familiar with this app? Or is this new information? Yeah. So I think this video shows a little bit more about how to actually use the app. But I do want to be respectful of
So you're already using ChatGPT.
okay, we're not using ChatGPT. I want to be respectful of folks' time, and I know we're almost at the end. But essentially, this is on, again, this is all linked, but this is the video on how to use the app. But from what I've heard from other people is it's pretty intuitive and is not difficult to use. And the other cool thing about it is you can share appointments with other people. So you can do this on your on the service recipient's phone. And then they can actually share the information and the appointments with you. They can email it to you, I think. They can send you a calendar invite. So it is something that allows for collaboration between you and the service recipient, which I think is really nice and helpful about the app. So we have made it to our time and the end of our time. I do want to put the link for the survey in the chat. You can also scan using the QR code. And then again, I'm going to put the PDF of the PowerPoint as well as the link to the PowerPoint in the chat. So everybody has it. All of the links are already in the PowerPoint. Everything is clickable. You just have to click on the resource you're looking for, and it should automatically pop up for you. And here again is the link to the presentation in case folks need it. But I do want to say thank you all. We appreciate your time, attention, and participation. Today's webinar was hosted by DVHR through the Washington Healthcare Authority. We would like to remind you that the slides are put in the chat, and the video will be posted on YouTube, but please make sure that you do head over to the FCS website because there's tons of information on the website as well as links to our future trainings. Thank you all so much for being here. I am going to stop the recording.